Co-occurring disorders, effective treatment, Michelle McLean, Liberty University. History of the client. A client has recently come in reporting that he has been feeling down and withdrawn, that he's been having a hard time getting out of bed in the morning, and he now lacks energy and avoids getting involved in any outside activities. He has become more isolated from friends, and he does not return calls to customers or friends. He's lost interest in work and what he used to enjoy doing. And this has been happening for approximately the last 4 months. 4 months. So the client has entered into the inpatient treatment due to feeling down and becoming more isolated and withdrawn. The client has slowed and restricted movement. So he gets annoyed when he's asked any questions about his drinking. So the diagnosis for this client is that the client meets criteria for the following DSM-5 and ICD-10 diagnoses. And the number is 303.90 and F10.20, which diagnosed the client as moderate alcohol use disorder diagnosis. When an individual has 4 to 5 criteria, the alcohol use disorder diagnosis is considered moderate. And moderate alcohol use disorder is sometimes referred to as problem drinking. So the client has been experiencing 4 of the criteria. The 4 criteria are withdrawal, social interpersonal problems, neglected major roles, physical psychological problems related to use and activities given up. Client meets criteria for the following DSM-5 and ICD-10 diagnoses, and that's 296.32, F33.1. And this is for major depressive disorder, recurrent moderate. So out of all of the symptoms, the client is experiencing about 5 of the symptoms, and they are depressed mood, diminished pleasure in activities, reduction of physical movement, and diminished ability to think or concentrate. So, why is co-occurring disorder important to know about during active treatment stage? So, co-occurring disorder is important to know because about 50 to 60% of victims who have substance use issues will also develop a mental illness. When an individual develops another sickness and with the addiction, it is called co-occurring disorder, which is also known as dual diagnosis. Common mental health disorders include depression, anxiety, or bipolar disorder. Mental health disorders that exist simultaneously with substance use, such as alcohol and drugs. Drugs would be considered marijuana, opiates, and a person being recognized with the above described conditions should seek a health specialist as soon as possible for treatment. So the treatment that is needed to address the co-occurring disorders, the most effective way is to treat both conditions concurrently to increase a more positive outcome. So what happens is sometimes a patient will go in to see a healthcare provider, and they will only treat one disorder, which this can be very, very dangerous, because if a person is wrongly diagnosed as just have being depressed, but they're also drinking and they have a substance use disorder, it could be very detrimental to that person. And it could lead to non-treatment and maltreatment, severe health issues, as well as death. So because each person is different, the treatment must be tailored to that individual. For effective treatments to happen, having the appropriate treatment depends on the problems and the severity of each disorder. The main goal is to determine the severity of the substance use disorder and mental illness. Once that is determined, the proper treatment can be used appropriately. This is why it is imperative for individuals to continue treatment programs and not leave prematurely. There are many treatments to aid patients in helping them recognize that they have an issue. It's just the fact of actually going to get diagnosed is what is causing the problem. So once that is understood, active treatment can help with the patient's social skills as well as the behavioral skills. So in the active treatment stage is where a client acknowledges that they have a substance use problem and they're currently seeking help to find ways to stop using. Active treatment stage finds ways to support clients in terminating substance use by using different methods and activities, such as educating the client on their substance use disorder or mental illness, and by developing the client's social skills through participation in groups and to develop healthy ways in coping with everyday life. So the outline here is that, hello everyone, my name is Michelle McLean. The topic of discussion will be co-occurring disorder and why effective treatment is needed. So the topic is important. This topic is important because over 9.2 million people currently suffer from mental illness and substance abuse disorder. According to Watkins et al. 2016, about every 12 minutes, over 41,000 people a year commit suicide from not receiving proper treatment. Therefore, it is vital for healthcare professionals to use proper assessments to correctly diagnose patients. So after hearing this information, what are your thoughts? Why is co-occurring disorder important to know about? The importance. Many people with substance use disorder are at high risk of developing more disorders. The presence of substance use disorder combined with mental illness is called a co-occurring disorder. In the 2018 National Survey on Drug Use and Health, roughly 9.2 million people have co-occurring disorders in the United States alone. So finding ways to show that these symptoms create issues can lead to successful treatment. So what goal will be achieved in a group setting of recovering addicted individuals with the topic of choice? The goal to be achieved in a group setting with co-occurring disorders will help individuals from relapsing. In addition, the goal is to aid individuals in learning coping skills to negative thoughts and self-sabotaging self-sabotaging ways that lead them to substance use. It will also equip individuals with social skills that help them reconnect with others who have gone through similar situations and circumstances. So, what are some outcomes and research findings in the research from this topic in treatment setting? Well, when treatment for mental illness and alcohol substance use are treated simultaneously, the outcome has been better short and long term, and the overall quality of life is improved. Therapy in the last 30 years since 1991 has collected a significant amount of evidence showing successful results. So combining psychological, educational, social, and even pharmacological interventions have proven to address the needs of patients. It is the most effective treatment program for people diagnosed with co-occurring disorders. So now it's your turn. What questions would you like to ask or information you would like to share regarding co-occurring disorders and the effective treatments that are needed? So here's the group discussion and processing session. And a few questions that I have are, what are ways we can counteract negative thinking? How do you feel about co-occurring disorders? Do you know anyone who may suffer from substance use or mental illness? And if so, do you know if they are currently getting the proper treatment that is needed? Should individuals tell suffering from co-occurring disorder? Because that may be a hard one for some individuals to let their doctor know that, hey, I'm feeling this way, but I also have these symptoms over here. And why do you feel co-occurring disorder is important to know about? So in the process and activity objectives and goals, this is a group activity where for anyone who is having any kind of negative thoughts or is feeling down or sad or discouraged, because we all go through those times when and just not in such a good mood. But to counteract that, there is this activity that I call popcorn positivity, and it's modeled after popcorn prayer, which is used in Western Christian tradition. What happens is that in a group, one person will say something nice or positive to the person sitting next to them or standing next to them, either to the left or the right of them, whichever way, and it just goes around in a circle, and then the next person will do the same thing, and then the next person will do the same thing. And this will continue until the last person has said something nice or positive to the first person that spoke. And this will be done in each session. So the takeaway from it is that now whenever the group members have left, that each person will have something positive or something nice that was said about them. And this can even be written down where so the person can keep they're having a down day or a bad day. They can pull out this piece of paper and remember that, well, so-and-so said that this positive thing about me, that I have a way of speaking to people and it's a nice way, or whatever the case may be, or that I was looking really nice that day. But it's something positive to counteract the negative thoughts and the self-sabotaging thoughts. So the next time you're feeling down, remember the positive of what your group members said about you. In conclusion, co-occurring disorders, it affects over 9.2 million people. And that's only in the US alone. And that's very disheartening. And and especially to know that every 12 minutes, over 41,000 people a year die. And that's due to not being properly diagnosed. A lot of the people commit suicide. And that's very, very unfortunate. Substance use and mental illness, they're the most common that are combined with each other, causing the co-occurring disorder. But, however, when this is diagnosed properly, it can help give individuals the right treatment that is needed, especially to avoid suicide or any type of death. This would be very, very vital for an individual with co-occurring disorder. And it would also lead to effective treatment. And when you get effective treatment, it leads to the better quality of life, favorable outcomes, being skills to deal with certain situations and certain circumstances that you would usually turn to the alcohol or the drugs in order to cope. But now you're finding different ways to cope. And it leads to a positive outcome. And this concludes my session. And I just want to say thank you.